There's not an age group that isn't susceptible. We've had a 5-year-old in Michigan test positive for COVID-19. We've lost 3 people, and there are a number of people that are on life support as we speak.
Governor Whitmer, thanks so much for joining me. I know that the numbers and the information is changing so rapidly in this situation. So why don't you go ahead and just give us the latest numbers and testing and cases and things that you know right now.
The good news is that we've got a lot of private labs that have come online. The challenge is that sharing of information, and I think we're fixing that. But at this juncture, we know that there are numbers from 2 over a week ago to being over 100 just yesterday and a lot higher than that today, tell us that we have a serious community spread issue here in Michigan. That's why we took the aggressive actions. I think that they've been an important step in mitigating community spread. But I think the sad truth is that we've already lost 3 Michiganders through COVID-19. And I think that's why it's so important that people take this seriously. We want to share this information so that people understand there's not an age group that isn't susceptible. We've had a 5-year-old in Michigan test positive for COVID-19. We've lost 3 people, and there are a number of people that are on life support as we speak. It's critical that everyone does their part. If we want to flatten the curve, protect people's lives, and shorten the amount of time that our economy is going to struggle because of this, every one of us needs to do our part.
So then that leads to the next question of, are there going to be any more executive orders in the next couple of days that might restrict our movement even further to try to flatten the curve?
Well, I want to start with this. I've issued a number of executive orders, and they've been aggressive, and Michigan's been on the leading edge of the work that states are doing. And it's not a partisan thing, because I can tell you I'm working very closely with Mike DeWine from Ohio and a number of other governors across the country. The fact of the matter is these actions were taken not lightly. In fact, they weigh very heavily, knowing that there are going to be kids who are out of school for at least 3 weeks, that we are going to have people who are laid off as a result of these actions, or small businesses that are shuttered. I know that this has created hardship, but I also know that if we don't take this aggressive action, that this community spread will threaten more lives in Michigan, and our economy will take a lot longer to ever get back up and online. And so it's really critical, these actions that we've taken. As this evolves and as things change so quickly, there may be necessity for additional actions. Last night, I issued an executive order that will make it easier for us to set up some daycare facilities for frontline healthcare workers. It's really important that these parents who are taking care of Michiganders, but don't have a place for their kids to go while they're working, have that ability. And so that was just the latest. And I would anticipate there will be additional actions, but I'm not announcing anything in this moment.
Let's talk a little bit about the medical personnel that are on the front lines in this crisis. And with the numbers of cases that are rising now, we've heard a lot of reports, concerns from the medical systems about the lack of supplies, masks, ventilators, and also even gowns. What work is the state doing right now with the hospital systems and the federal government to try to get them more of those supplies?
Yeah, so one of the things that was reported kind of widely was we had a conversation with the White House earlier this week, and they suggested that we go outside the federal government to solve some of these problems. And while it was kind of mind-boggling to hear the federal government tell us this, it also was an eye-opener, and it inspired us to really start investigating and working with partners in the private sector and partners across government, frankly. We are looking to produce a lot of hand sanitizer here in Michigan. Companies that didn't do that before that are now trying to gear up to do that. We have a number of opportunities to create masks in Michigan, and talking to employers who have some masks so that we can get them to the front line healthcare workers. And so there are a lot of different pieces to solving this problem. None of them supplants what the federal government needs to and should be doing, but they can all help us meet the need here in Michigan a little bit better.
Let's talk about kids and parents who are home right now. We've got many kids who are watching. This is coming on the first week of them being home, and they're looking and hearing rumors going around that maybe they wouldn't have school for the rest of the year. What can you tell parents and kids right now about where they might be in the next couple of weeks?
Well, we're 4 days into this 3-week break that I have ordered. I cannot tell you where we will be come April 5th. All I can say is that we are moving as aggressively as we think public health demands, that we are using the best science and facts to make decisions to make your children and your families and our employers and our employees safe. This comes with great hardship. As a parent of kids myself, I know that my kids are home and they'd prefer to be in school. Even though they're teenagers, they still would prefer to be in school. But the fact of the matter is, we have to do what the right thing to do is on behalf of our kids and our teachers and our people in this state. And as we get closer to April 5th, as I have more information and we know where we are a little bit closer to that date, I will be very clear about a decision that I have to make and why I'm making it, but it's too early to know what that's going to be.
While we're talking about the medical system and taking on all of these cases that are coming in, let's talk a little bit about mental health. And it's incredibly anxiety producing for thousands, if not millions of people. Is there anything the state is doing right now, and maybe in the coming weeks, taking a look at some kind of mental health services that would be offered to the community to help them work through this?
Yeah, I think that's a great question. I know that our chief medical executive is very focused on this as well, on top of getting the tests and meeting the immediate physical needs. The mental health needs and behavioral health aspects of this are critically important. You know, having people isolate and to not interact, to not do the regular daily activities is distressful, and if you're someone that is already confronting some stress on that front, it just compounds it, and we're aware of that. We are looking to see how we can help people manage that. You know, I think that it is important that people keep some sort of a schedule and try to get outside when you can, not in a group. But if you can get out, and whether it's taking a dog for a walk or walking around the block or walking up to the park, getting a little fresh air and trying to take care of yourselves in this incredibly stressful moment that the whole world is going through, and knowing that you're not alone, I think is helpful too, and we will continue to focus on this.
Yeah, every little bit counts. And one last message, as this feels like this last 10 days, it feels like a lifetime has gone by. Your last message to the people of Michigan.
Well, this is hard. None of this is easy. Our lives have been upended, and yet we must keep going. We must do everything that we can, and every one of us needs to play our part. I ask that you do what you can do to mitigate community spread, observing the 6-foot perimeter, ensuring that you're staying at home when you can, helping out someone who is homebound because they're medically vulnerable, getting onto 211 and volunteering if you're able to help another person, or even just going to the Red Cross. You can go online and schedule an appointment. I went yesterday and donated blood. They desperately need blood supplies. So if you can take care of yourself, that's first and foremost. If you have the bandwidth to help out a little bit more, there are certainly ways that you can do that in a safe manner that makes a difference.
Governor Whitmer, we'll be talking to you again soon. Be well.
Thank you. You too.
Okay.